All right, y'all. I'm over here in Baltimore, Maryland, and I'm over here with what's your name, man?
Isaac.
I'm over here with Isaac, and first of all, tell everybody where are you from?
So I was born in Washington D.C., but I grew up in PG County, Maryland, Largo to be specific.
Okay, so he does a program in Baltimore. And what's the name of it?
It's called Goodworks.
Goodworks.
Yeah.
And tell everybody what that's all about and what exactly do you do?
Yeah, so basically to put it in like the simplest terms, we go to bad neighborhoods and we teach young people how to save a life. So we talking about like CPR, how to treat gunshot wounds, stabbings, how to help people who overdose and all that. So we visited, we've been in Baltimore. We basically just watch your YouTube channel, find places to go, reach out to organizations out there, and we go out to those cities and we do these trainings for free.
Okay. What exactly kind of training is it? What exactly do you do?
So basically, we do a standard American Heart Association CPR class. I'm a certified instructor. We go out there, we teach it, but we teach it in a way where like it's relatable, like where you can remember how we taught it for like years to come. I feel like you can grab anybody who went to one of our workshops and be like, yeah, I remember how he showed us how to do CPR because it's in a unique way. It's different from like if you were to go just sign up for a CPR class now, like in the city for like, $40, $50 or whatever. The lady then probably taught like 10 classes. She burnt out. She just, everyone in there just trying to get a certification. We make it fun. We make it engaging. We make it like memorable.
So if you go to the places, you say you follow some of the places I go,
yeah.
Like how do you, like in those areas, how do you get those people to be interested? And what's the age range of the people that you get?
Yeah. So our target age is between, so the youngest we've done so far has been 9 years old. We go up all the way to the age of 21. And how it works is, I just came back from Detroit last week, and that was my second time in Detroit. And we did about 4 events in Detroit. And how we basically do it is we reach out to organizations that already exist. So like if you already got like a mentoring organization, or you got like a youth group or something like that, or you just like an OG and got like a bunch of young ones around you that you want to have the skill set, we would come out there and we would do our workshop. And it's real quick, not real quick, but it's not long and it's easy.
Where did you go to school at, and where did you get the qualifications to do this kind of work?
So when I graduated high school, first thing I did was I joined the military. So I got trained as a medic or a medical technician in the Air Force. And I got that training, and then I went to college right afterwards. So like I went to college around like 20. And then I graduated with a bachelor's.
You said you went to Towson?
Towson, yeah.
Okay.
And I graduated, I got a degree in health science. After getting a degree in health science, my first job was with the United States Secret Service. I worked as like in a medical, my job was to make sure the agents stay healthy. So when they travel with the president.
How long did you do that?
I did that for about 8 months, and then I got deployed. And I got deployed for about 91 days or something like that. And that's during the deployments when I start, thinking about how I can execute this mission of going to our communities and teaching our young people how to save lives. And then after my deployment, I started doing this full time for about like 6 months. And like I said, I was already a certified instructor. I had already had all the military medical training. I got a degree from Towson in health science. Like I had a pretty strong medical knowledge, I think, and I was able to teach kids like in an easy way, or teach young people in a relatable way that wasn't like boring, at least not to me, or at least so far what I've got. And then right now I'm in grad school. I'm getting my physician assistant or physician associate. And yeah, so that's about all my schooling so far.
Well, you almost qualified to be the president, huh? Hey, what I wanted to ask you, do anybody else work with you?
Yeah, so so every city I go to, this is a pretty important point actually. So like, for example, I was in Detroit last week, and I was the primary instructor, like the one instructor that's like doing the workshop. I had a secondary instructor with me. He's a certified instructor with the American Heart Association. And then I have a bunch of volunteers who are either pre-med students, pre-PA students, nursing students. And what happens is usually, like, since they're from the local community, by the end of the class, they can like make relationships with people who are in the that's in the room with them. So like we have young people who come for the workshop. By the end of the class, they have questions about how to be a doctor or some shit like that. Like they can make connections with the volunteers. So yeah, we have volunteers and we have instructors.
Do you have a website or something?
Yeah, for sure. So our website is gworks.org, g-works.org. So g-works.org. And our Instagram is at dagoodworks, dagoodworks.
How many different cities have you been to?
So far we've been to Hagerstown, we've been to Baltimore, we've been to Detroit. We have now partnerships in Atlanta, Chicago. We're about to go to Philadelphia. And the places that I've mentioned, we've been there several times already. So we've been to like Baltimore like 3 times. Hagerstown, we're about to go again. I've done 4 events now in Detroit so far. So every place we go to, we plan on like keep going there to build that relationship.
So people can donate to your
absolutely.
How do they do that?
So if you just go on our Instagram, you go to our website, or if you just go on our Instagram and go to the link, it will take you straight to the donation page, or just go on our website and hit the donate button. And really it's like, so like I said, I'm a certified instructor. I got other certified instructors on my team, and we volunteer our time for completely free. We don't charge anybody anything for these workshops. Our whole goal is to make people in these communities better bystanders, because they see the craziest stuff in the world, and a lot of them don't have the skill set to help people. So we're trying to give them that skill set. So like I said, if you go and try to sign up for a CPR class or whatever, just regularly, it's going to cost you like, $50, $60.
Right.
But for us, the only charge it costs us is that we got to go to the associations and get those certifications, and that's only going to cost us about $20 per person. But it costs more in the public because you're paying the instructor as well. So our donations go straight to getting people who are over 16 certified, so they can use that for jobs, use that for college programs, and it also helps us get more equipment so we can do better trainings and stuff.
I never thought about the job angle.
Yeah, absolutely. If you're 16 and over, we come out to your work and do a workshop with you or whatever, we get you certified. You can apply to get certain jobs that require CPR certs.
Okay.
For free, we do that for you.
So what made you interested in doing this?
Yeah, so I guess 2 things. So I graduated high school 2017, and every single year, I guess, since I graduated high school, someone from my school has either died from violence or someone from my community has died from violence. I'm 23 years old now, and it's not just an issue with my community, it's just like an issue in general with the black community. Like we're killing ourselves, and the issue is we don't have the skill sets to save ourselves, and that really bothered me. So that stuck with me for a while. And then the second thing, I guess, like what really did it for me was when I graduated college, I went up to Towson for college, and I graduated 2021, and I started working in Southeast DC. So I got an apartment in Southeast, and one day I went into work. I parked my car like next to like a basketball court. Some kids was playing basketball. They're probably like 13, 14 years old. Parked my car, go inside, come outside. I was inside for 10 minutes. I come outside, my car is gone. So I'm like, damn, like, I'm not gonna lie. I be parking stupid in DC too. Like
this was in DC or
in DC, Southeast,
okay.
and like I said, I be parking stupid in DC. I be parking in front of fire. I just know that sometimes. So I'm like, damn, they probably finally towed my car. So I called the tow people. I'm like, did y'all tow a gray Dodge Charger from Eastern High School? Like, today? They're like, nah, we haven't towed no cars in the area. So I started walking up and down the street, looking goofy, trying to find my car. Ended up calling just 911, and turns out my car got stolen by some kids, like a few seconds after I left the car. And to be honest with you, like, I wasn't even angry. I got good insurance, I'm gonna get the money right back, and I ended up getting my car back. But for me, I was impressed. I'm like, it took, what type of boldness and courage to just steal somebody's car. You don't know what's on the other side of the car. You don't know who the car belonged to.
Right.
Like, I could have been anybody.
I had a car stolen 4 times in Detroit.
Shit, that's crazy. and like these kids and it's kids doing it. They're like 14, 15 years old.
And broken into more than that.
You see? And the thing about it is that like the whole kill is like, you you can have the boldness and courage to do something like that. It takes the same level of boldness and courage to jump in and save somebody's life, jump in and start CPR, jump in and stop the bleeding.
Right.
The only difference is you have the skill set to do one, you don't have the skill set to do the other. And that's kind of where we come in. We're trying to give young people who are already out here, you know, being bold and courageous in the worst ways, the skill set to do something positive, you know. And that's what's been the motivation to do it so far.
Do any of them ever come to you, or they just, you have to go out and recruit them?
Yeah, so a lot of people, and this is kind of why I'm glad, you know, we met to do this, because it's like a lot of people don't even know that this is available. And like even if it is available, no one's really looking for it.
Especially in our community, in the inner cities, in the specific areas that I go.
Right.
You know, and we need this the most.
Exactly. Exactly. And that's what it is. It's like, as soon as like I can go. So I remember the first time I went to Detroit, and I start teaching. As soon as I start talking, it's like a bunch of group of guys. They're probably like 13, 14 years old. They're put in there because they have like a program director that just put them in the room. Because
where were you at in Detroit?
I was at a mentoring program. I was where I was like Dearborn or something like that.
Dearborn, okay, yeah.
And as soon as I start talking, I hear them whisper like, "Bro, fuck this nigga talking about, bro. I'm trying to like they're not trying to hear nothing from me, right? Because they think I'm there to like mentor them. They think I'm here, and that's what I try to explain to people. I'm not here to mentor nobody. I want to provide people a skill set that they can use, no matter what you end up doing with your life or what you end up pursuing. This skill set is going to help someone in need, and possibly so. Immediately when I start talking about gunshot wounds, start talking about drug overdoses, you start talking about like CPR, and like they get locked in, they get excited. It gets to the point where by the time the class is over, you have like kids who you thought didn't care, or kids who would have never even cared about none of this. They start asking more questions like, damn, like how do I learn more about this, or like I'm thinking about being a doctor, like stuff like that is kind of what happens.
Yeah. So where do you hope to go with this? What are you trying to accomplish?
So my goal number one is to make these life-saving skills like a basic skill set that people from our community have. Like I want to be able to walk up to any 13, 14, 15-year-old in the inner city, and they understand how to do CPR. They understand how to you know apply a tourniquet and stop the bleeding. They know what Narcan is. Like we're in a drug epidemic, and I go to some of these cities, and none of the kids, they 16, 17 years old, have never heard of Narcan, and we're in a drug epidemic. Like it's like this is a drug that can reverse these overdoses, and you people overdosing on fentanyl and all that, and these kids have never heard of it. So I want to come to a place where it's common knowledge, and also I just want there's so many ways to improve public safety, and this is my way to do it, and that's ultimately what I want to do, is improve public safety in the Black community.
Okay, man, that's good what you do, and it's definitely needed in our community, and it's good to see some young people just interested in something else besides some of the stuff that I show on there.
Yeah.
You know, you got anything else you want to add or put out there?
Yeah, so I already talked about the donations. If you feel the need to, if you feel like you like what we're doing, and you feel like you can support our mission, any donation helps. Because any donation can go towards someone getting certified in CPR for free. It can go towards us getting new equipment to make sure our trainers are better. And then lastly, which I think is the most important part, is if you're an organization out there in the inner city, you work on underserved youth. So let's say you got a mentoring group, or you like a school or something like that. Or even if you just like you're an OG and you got like 10 youngers around you that you want to have this skill set, hit us up on Instagram, and we'll work something out. If we have the means and resources to get to you, we will get to you and host a workshop. And I promise you, it's life-changing, literally. And I appreciate you for having me on this show. You know what I'm saying? I gotta remain relatable, you know what I'm saying?
Okay.